Having the vapotherm portable and mobile has been, like game changing for the children to be able to have normal days, letting them be children, letting them play, so they're allowed to come away from the bed space. A lot of the children on vapotherm are in our high dependency unit or in our intensive care unit, and it's just giving them the freedom to come in a safe environment and do what children normally do. And especially when they're here long term, they're developing, they're walking, standing, they've been in bed a long time. It's just helping all of their recovery, but just, it makes parents happy to see their children doing what they should be doing as well. So it's that all round, they're getting a lot of something from being mobile.
The machine is so much more mobile and lighter to move. So as a therapist, I can actually manoeuvre the machine myself and keep a good eye on the child and work on the stability of whichever age of the child that I'm working with. Whereas with the older machine, I needed lots of extra pairs of hands just to move the machine. And it was the swivel wheels on this machine do make it much more mobile. So you can get in and out of places that you couldn't have got to before with the other machine. The comfort for the child of whatever age is absolutely vital, and parents tell us that they're quite worried about how the child will react to it. But the thing I like about having the nasal cannula is that a parent can see their child's face, can give them a kiss when they're sad, or just when a parent wants to give their child a kiss, and you don't have anything else going on in front of that child's face. From a normal development point of view, it's really important as well, because if a child has a mask stuck in front of their face all of the time, their vision might be altered as well, as in they're looking at something all of their time. And a child uses every single one of its senses in order to develop all areas of their development. If speech and language, if a child can't see, then they might not be able to pick up cues the same, they can't see the parent's face. When parents are picking up their children as well, having a comfortable nasal cannula way to deliver oxygen is so much easier for the parents, so the parents are more likely to take their child out of the cot space or onto their knee and things like that, so it's totally vital.
To set it up, make sure that they're happy with the controls and the alarms and how to interact with the screen. But it hasn't taken too long. As I say, we were already very familiar with using vapotherm, so it's been quite straightforward, and the staff who I haven't been able to directly one-on-one train have been able to kind of figure out the controls, or other staff have been able to just cascade that training further. Before we had vapotherm on the unit, what we found was actually a lot of our patients had to go to our paediatric intensive care unit for some respiratory support, whether that was non-invasive ventilation through like CPAP, or quite often, quite a lot of them ended up needing ventilation. What we've found since, and as well, we also now have a dedicated high dependency unit that we can take a higher acuity of children, and actually what we find is we quite often don't need to escalate our patients up to PICU, and we can manage them quite well on the ward or in HDU. Not having to escalate the patients to PICU is good for the patients, because there's a lot of complications that come with needing ventilation. So we find actually that we have better patient outcomes. And it also means that we don't need to send children to PICU just to be supported from a ventilation point.
So those first few 3 years of life are absolutely critical to allowing children to meet their developmental milestones and practice those skills. Once a child is a little bit older, it's really important to get them up and out of bed and moving away from their bed space, because children who are stuck in bed for long periods of time become much more bed-shaped. They want to be in their bed. That's a really depressing place for lots of children to be, and children just want to be children and they want to be able to play. So if we can take them away from their hospital bed space into an environment that allows them to play and move around, then that's beneficial for psychological reasons as well as their rehab and therapy.
When we're looking at like mobile units, we want them to be obviously easy to use for like the staff. We've found now with the new model is that the fact that it doesn't require air, because our patients require more flow rather than oxygen support often, we go through a lot of air usage. So we find that if they're in the playroom or just even transferring them for X-ray or CT, we would have to have a lot of backup air canisters with us. And it can be quite stressful from a nursing point of view, especially if you've got to take a sick child to CT or X-ray, that you're very wary of those air canisters running out, and that will then compromise their ability to cope with their breathing and things.
Having the vapor portable and mobile has been, like game changing for the children to be able to have normal days, letting them be children, letting them play, so where they're allowed to come away from the bed space. A lot of the children on Vapotherm are in our high dependency unit or in our intensive care unit, and it's just giving them the freedom to come in a safe environment and do what children normally do. And especially when they're here long term, they're developing, they're walking, standing. If they've been in bed a long time, it's just helping all of their recovery. But just, it makes parents happy to see their children doing what they should be doing as well. So it's that all round, they're getting a lot of something from being mobile, yeah.
The new machine is different because it doesn't need that air supply. It just requires oxygen. And from speaking to the staff who have been using it, they've said it's an absolute game changer. Especially, we had somebody who took a sick patient down to CT recently, and she just said that the experience was so much less stressful, and that it was just the device itself moved a lot easier, it was less cumbersome, and she wasn't worried that she was going to run out of air.